Thank you so much for having me. I'm just going to go ahead and share my screen. Here we go. And I have this terrible habit of just adding a whole bunch of slides at the last minute. So I'm going to get through this in 25 minutes. So welcome to my presentation about beyond joint pain, how we can support the needs of people with inflammatory forms of arthritis from the full scope of occupational therapy. So just a quick few disclosures. I have a contract with the Global Healthy Living Foundation, which is the parent company of Creaky Joints nonprofit, that I make short form social media videos for them. And I also was paid earlier this summer by AbbVie pharmaceutical company for a video consultation. And then I just got accepted this week to the YouTube partner program. So following in the amazing Dr. Andrea's footsteps yesterday. And I just started the Amazon quote unquote affiliate program on my website. So those should not influence what I'm talking about today, but just a quick introduction to me. As I was introduced, I've been an occupational therapist for a while. I really, right now I focus a lot on patient education and leading online self-management and peer support groups. So also as OTs, we always look at the bigger picture of the person's life. So I also want to mention I'm a mom, I'm a wife, I'm also an advocate and a friend and a dog lover. I loved the dog presentation yesterday. And yes, I am a swing dancer, not too much right now because infection control issues, but I'm going to review today the systemic extra-articular, fancy word for just not in the joint, manifestations of inflammatory arthritis. That's going to be a pretty quick 10-minute review, maybe even shorter, and then move into the evidence-based strategies. And I really just wanted to first say, I loved the two presentations that preceded me, Dr. Martin and Dr. Lee Bagley. Those were just wonderful. And I'm going to try to tie those into mine too. So just really quickly, rheumatoid arthritis and inflammatory arthritis are very different than osteoarthritis, even though both have the word arthritis in them. So inflammatory forms of arthritis involve multiple organs, multiple body systems. They're caused by an autoimmune process, and they are associated with a reduced life expectancy. I don't say that to scare people, but and with the current treatments, that's projected to not be as much of an issue in the future. But it helps people knowing that helps people understand that this is not quote unquote just osteoarthritis or just a sore hand. And osteoarthritis is not a picnic either. We're not going to play the disease Olympics where, everyone's suffering is important, but they're just different diseases. So osteoarthritis is local to the specific joints affected, and it's caused by mechanical wear and tear. So I'm really active on social media. I love connecting to other patient communities there. And this was really interesting because within 24 hours, I posted this on Friday. This has become my most liked and shared post on Instagram. And so I think it just speaks to the fact that people with inflammatory forms of arthritis really want it to be recognized that joint pain is just a small slice of this pie on what's difficult for us. Now, I know that's weird to say at a pain conference. I understand this conference is about pain, but that pain in an inflammatory arthritis patient is in the context of all these other challenges and limitations, fatigue, difficulties with self-care, social isolation, dealing with weird comments like you don't look sick. So we're going to go into all of that later. But I just wanted to kind of underscore it's not just joint pain. That's kind of the title of this presentation. And, another way of looking at this is, people think rheumatoid arthritis, it feels just like, ouch, my knee hurts, but it's actually this longer, more psychological experience. I'm overwhelmed. Which medications should I take? Why are the side effects so scary? I'm too young. Friends and family are saying it's just arthritis. It's not that bad. What does this mean for my future? Can I work? And then as Dr. Martin, mentioned, when you get a diagnosis, then the patients go to social media groups. And sometimes there's negative effects of that, getting scared by horror stories that may not reflect your unique prognosis. So just really quickly, the types of inflammatory arthritis, it's not just rheumatoid, it's also ankylosing spondylitis or axial spondylitis. Those are different. Actually, I should have added them differently. And then, I did. There we go. And psoriatic arthritis, as well as lupus. So they share in common the symptoms of joint pain and also the systemic symptoms like fatigue or malaise, fever, and all the other systemic issues like cardiovascular, respiratory, and skin issues, as well as GI symptoms. And people with these conditions, as mentioned earlier, do increase and have an increased risk of anxiety, depression, other psychological challenges. So I just want to take a minute to recognize fatigue, because it is has one of the most drastic impacts on daily functioning. And it's sometimes like, I'll just say, for example, every time I go to my rheumatologist every 3 months, they make me fill out a little chart that has all these questions about pain. There's not a single question about fatigue, but fatigue might impact my quality of life much more severely than pain. So what actually is fatigue? There's not one universally recognized definition, but it's usually a debilitating period of exhaustion that interferes with normal activities. I think that would resonate to the patient population. Let me know in the chat if it doesn't. It can also be accompanied by the decreased ability to think. So that's kind of like that mental fatigue or brain fog, decreased ability to move. That's more the quote unquote physical fatigue. Not that they're, anyway, and then whole body tiredness that is present even if you sleep enough. So I have all these smiley pictures of me everywhere. So I wanted to make sure to get a picture, because I do get fatigued too. And so that's a picture of me taking a nap. So the social effects are huge, being told constantly, you don't look sick, you're too young, when your reality is that you're dealing with all these hidden, invisible effects. So I did a photography project, as mentioned earlier, called My Invisible Illness Photo Shoot. And that's where that picture's from. Jessica Keener Photography helped me with that. And then there's the misunderstandings. I wish I could see you all now. I hope some of you are laughing, but you keep using that word. I don't think it means what you think it means. From The Princess Bride, they'll say it's just arthritis, or and this tends to actually be really profound on relationships, unfortunately, including like romantic relationships and partnerships. That lack of understanding that this is a systemic disease, or being accused of just using it as an excuse. And as Dr. Dana Lee Bagley mentioned, the fluctuation of symptoms, the unpredictability. I got this photography idea from another account on Instagram, but I showed, this is me in the same location in my home on a bad day where I'm, my son at the time, I think was 4, I'm trying to still participate in my life, but I can't really get up off the couch. So I'm kind of like handing him Legos, and providing some encouragement from the sidelines, versus on a good day, I am able to, actively participate. The thing I always mention that I think is funny is that he just loves Legos so much. In this picture, he's looking like, I don't really care if my mom's that engaged. But yeah, the point of this is to say that, I don't know sometimes when I go to bed one night, what is my next day going to be like? I've had rheumatoid arthritis for 18 years, and I'm an occupational therapist. I have basically a master's degree in everyday, managing everyday life with injury, illness, or disability. And I still don't know. And it comes down to the uncertainties, even though I know I have rheumatoid arthritis, I'm not sure exactly what's going to happen each day. I can make a prediction based on the past, but there's still a lot of uncertainties and unpredictability. So this slide is way too basically busy for today. But the point of this was to look at what people are going to social media groups to discuss in patient-specific, disease-specific social media groups. And it is basically a qualitative research analysis, and basically showed that the 2 primary things people were doing were they were discussing what we call in OT instrumental activities of daily living. Basic activities of daily living, like ADLs, those are things like being able to feed yourself, go to the bathroom, get dressed. Instrumental activities of daily living are the more complex versions of everyday activities, things like take care of children, care of pets, health management and maintenance, work. And that was a huge area. That's what people are going for, practical problem solving. And then the second was providing support and mental health in particular, saying, I feel so overwhelmed, I feel stressed, how do I cope with this? And so again, the reason I mentioned the instrumental activities of daily living, and that's in our occupational therapy practice framework. And I think sometimes providers forget that, occupational therapy isn't just about, making a hand splint. That could be a really effective tool, but we can help people really analyze what's going on with their everyday living patterns and how can they compensate or adapt to those. And I'm going to talk a little bit more about later. So my little, completely unbiased plug for occupational therapy. So a couple other things is that really to know that work participation is severely affected by autoimmune disease and inflammatory arthritis. Again, some of these numbers, they hope to go down, right? Because the biologic era only started in the early 2000s. The biologics are the medicines that work really, really well for rheumatoid arthritis. But, that lupus is one of the leading causes of work disability. Rheumatoid arthritis, 25 to 50% become unable to work within 10 to 20 years. Now that was in 2010. So that's already I'd love to see a study of the people who were diagnosed in the last 15 years. I'm sure that's better now, but it's not perfect. So, and ankylosing spondylitis, 10 to 20% are affected by work disability. So, okay. Oh, I'm actually on schedule. So what do we actually do about this? So how do we help people live? So in occupational therapy, we have a little unofficial mascot of our profession, and it's called OT Rex. So this is the OT Rex holding usually you see OT Rex holding the reacher. But basically if I distill my profession and my approach to helping myself and others with inflammatory arthritis, it's really down to these two options at any given time. Can I make the problem better or make whatever is going on better? Or can I adapt and compensate to it? So if whatever I'm experiencing is not going to get better, like those unsolvable problems Dr. Lee Bagley mentioned, I can still do something. It's not like, oh, give up. I can't make my pain better, so we can't do anything. We could still learn how to adapt and compensate. And I will say, most patients, when you initially get diagnosed, you go through a journey. The journey is exclusively typically focusing on remedial strategies initially, which is a little bit of part of the denial. You want to make the disease go away. How do I heal it? How do I cure it? And then over time, when you become more settled into the reality that this is what I have, it's a chronic lifelong condition. It might get a lot better than it is today. It might get worse. How do I adapt and compensate for this? So an example for rheumatoid arthritis, sorry, again, I'm breaking all the rules of too many words per slide. You might have all these limitations mentioned in that little pie chart. And what the remedial strategies or the make it better strategies could be pain relief tools, improving your underlying inflammation. Obviously, medications would be one of them. That's outside the scope of occupational therapy, but, learning tools for medication management if you're overwhelmed with the tasks. I will say a lot of people have needle phobia, and syringe, or auto injectors are the way a lot of our rheumatoid arthritis medications are delivered. So learning how to do that, learning how to manage your stress. And then there's the adaptive and compensatory tools, things like life hacks, adaptive equipment, that's that literal reacher. I even have, I'll just show you right now, sitting here, my pill case that has like an easy press button on it, which helps me with opening and accessing my medications. It also is a joint protection tool. I should have put joint protection under there with life hacks. But joint protection in the sense of I'm not having to sit there and open and twist my each medication bottle. I get it all set in one sitting. And then we're going to talk a lot more about like mindfulness and acceptance in a few minutes. So these are the tools we're going to look at. Oh my gosh, so much to talk about. So fatigue. So it's really important to understand that like fatigue and any, fatigue, pain, psychological factors, everything is all constantly interrelated. So the good news is about that is that if you improve one area, it'll have a positive effect on the other areas. And the bad part of that is if you have a bad thing going on with one of these areas, it will potentially affect and most likely affect the others too. So, you can improve fatigue by addressing the underlying inflammation to a degree. Just like Dr. Martin said earlier, sometimes pain persists despite inflammation getting better. Same with fatigue. Fatigue often persists in patients even when they're not just receiving anti-inflammatory treatments, but when their inflammatory markers are down, blood work wise, and even with a physical exam of the joints with rheumatoid arthritis, you could still have really debilitating fatigue. So that's fatigue is very complex, but what some of the things that are the most effective that are lifestyle choices for fatigue. And it's so unintuitive. Like we have to recognize that this does not make sense. If you feel a lack of energy, it does not make sense to exercise, right? Like just basic logic. You're like, I'm really, really tired. I'm going to exercise to get more energy. But actually there's again and again studies, not just studies on the regular population, studies on people with autoimmune diseases and inflammatory arthritis show that exercise results in improvement in not only fatigue, but sleep quality. So now you do have to do some trial and error on figuring out what's your just right challenge for exercise. I have a friend, Christy, who literally runs marathons, with rheumatoid arthritis. If I tried to do that today, I would have a severe flare up of fatigue. I would also just not succeed. So figuring out that just right challenge is something that an occupational therapist or physical therapist can really help with. And then stress management, stress drives inflammation, and that can exacerbate existing fatigue. And then also nutrition. I really try not to touch nutrition too much myself. I think it's such a specialty area, and that I really like to refer to registered dietitians. I know we have a few on the call right now. And then sleep is so important. I'm putting it on its own slide. So, adequate sleep does help with decreasing inflammation and pain and fatigue. Again, that positive cycle. And, people with rheumatoid arthritis are at a higher risk of sleep disorders, including sleep apnea, which even in the absence of other risk factors. So even if you don't snore, or you're not overweight, or any of the other typical risk factors for sleep apnea, people with rheumatoid arthritis particularly are still at risk of sleep apnea. So it's important to rule out a sleep disorder if you consistently are feeling really fatigued. It might not be just your rheumatoid arthritis or inflammatory arthritis. And you'd also want to look at other things like underlying factors that could be causing fatigue, like anemia and other like vitamin deficiencies. So, okay, those are some preventative strategies. And then what if your fatigue is there? How do you function like literally on a moment by moment, day-to-day basis? Well, as Dr. Lee Bagley mentioned earlier, we have these pacing skills, so pacing is part of what we call energy conservation. It's a common tool that we occupational therapists teach to people with multiple sclerosis and any condition that causes fatigue, now post, long COVID. And what you can do is, again, it sounds so easy when you just list it out. It's harder to do in your day, but, spreading your high energy tasks throughout the day and the week, alternate between easy and difficult tasks, taking rest breaks. I had someone I worked with that had a great idea. She just assigned different chores to different days of the week. So her pattern used to be just put off all the chores and then catch up on them on the weekend. But she didn't have the stamina for that anymore. It would just really knock her out. So she was like, okay, well, I'm going to clean the floors on Monday. Tuesday's going to be the bathrooms. Wednesday's going to be the kitchen. And that way she was spreading it out. And a couple other things, there's all these principles. And again, occupational therapists can walk you through the logistics in your own home context or your own environment. How can you have better work methods in your kitchen, for example, and delegate. Delegating is a big one for me, or doing things like, for example, for joint protection and energy conservation for cooking, I'll buy vegetables that are pre-chopped rather than having to sit there and chop them myself. So other couple of things, work accommodations for fatigue, asking for a flexible work schedule. I think that's a very reasonable accommodation depending on the workplace, and allowing for frequent rest breaks can really help. So, okay, now for the last 10 minutes, I'm going to move on to this is my favorite part to talk about is, the psychosocial strategies, again, just building on what Dr. Lee Bagley mentioned, but, how do you deal with these comments like you're too young to have arthritis and the deeper stuff. So I've created this, it's a little bit long, sorry. I created this chronic illness decision helper to help me, because I think, okay, one of the things that can get really confusing when you start looking at psychological approaches is that sometimes they're presented as just like, always do this, or always do CBT, or always do mindfulness. And I think what I've noticed is that the first question to ask is it a thinking problem? Like, is there a different way I could be thinking about my situation? Or is it a solvable, or if it's not a thinking problem, is it a thinking problem? Yes or no? If it's not, it could, like, me having pain is not a thinking problem. Like, I'm not thinking wrong about my pain. Now, obviously there are ways to use mindfulness and stuff to reduce it. But what I mean is basically that some of these are going to be problems that, despite all of your thinking tools, you're going to reach potentially a ceiling of effectiveness, right? We know that even if you do every perfect tool for, mindfulness and everything else, you may still be feeling pain. So first, is it a thinking problem? And then is it a perpetual or solvable problem? So, if it's a thinking problem, you might be able to reframe it. So here's an example. A thinking problem could be like the phrase or the saying this to yourself: nothing I ever do will ever make a difference in how my disease affects my life. It's hopeless. And that's a thinking problem because it's a distortion. You don't actually know the future for sure. It's true that it feels like, I'm a big fan of validation, right? So it feels like nothing I'm doing will ever affect how my disease affects my life. But, and this is kind of the reframe, it's like the future is unknown. I could still try to learn tools to live better with this. So that helps you reframe and still engage in life. Another one way of thinking about it is catching ants, automatic negative thoughts. So, if I forgot to take my meds, my automatic negative thought is I'm stupid. That leads to the feeling of frustration and the behavior of irritability. And the alternative is self-compassion. Little plug for what's going to happen later this afternoon with Dr. Kristen Neff. The situation could still be the same situation. And my thought could just be, I'm human, it happens. And that could lead to feelings of peace and behavior that reflects my values. So, okay, what do we do about these problems that are not necessarily thinking problems? They're not distortions, or just, like, for example, my stress about the uncertainties around my future with rheumatoid arthritis. I think that in this case, looking at, first of all, whether it's solvable or persistent, and then using strategies like acceptance and commitment therapy, which you'll also hear more about later this afternoon, has been by far, bar none, the most helpful for me in living with rheumatoid arthritis and accepting and accepting and moving forward despite uncertainty. So with ACT, you accept your thoughts and feelings. Acceptance doesn't mean resignation or giving up hope. It just means that this is what's happening right now in this present moment. The future might get better, but the present moment is this. Then you connect with your values, and then you take effective action. Again, this is like trying to summarize this in my 5 remaining minutes. So you'll learn more this afternoon, but first you make room for your feelings. And this is from Dr. Russ Harris in The Happiness Trap, fabulous book. Then you make room for your feelings. You allow them to be exactly what they are. And you don't try to reframe them. You don't argue with them. You don't say, is this a distortion or is this not? You just say, this is what it is. I'm feeling uncertain. I'm feeling worried. And then you say, what can I do right now that's truly meaningful or important? And that's different than asking, how can I feel better? And so his whole happiness trap is about how people get in this trap of trying to feel happier. And then they actually, it doesn't work. The more you try, the less happy you are. And I think it's the same with rheumatoid arthritis. I mean, certain people are lucky, right? It's great if you find like a diet or medication that puts you in remission. I was in medicated remission for 7 years. It was awesome. I didn't have to really do a lot different in my life, but the majority of people are not going to find that silver bullet, or if they do, it won't last forever. Like, again, I had it for 7 years and then it went away. So how can I not just focus myopically on feel better, cure it, heal it, make it go away? But what can I do today? How can I engage in my life now, despite this condition, rather than seeing it as something I need to fight or conquer against before having a meaningful existence? And so, ACT is based on, again, as Dr. Lee Bagley mentioned, psychological flexibility. And I really think it's freeing, right? Because the more that I focus on control strategies, like make my pain go away, make my fatigue go away, that's energy I could be using to engage in and again, what are the possibilities in my life right now? So I just want to validate anyone who struggles with this. I think this is the biggest thing that I don't hear a lot of people talk about, which is that the pain isn't necessarily the problem. The fatigue isn't necessarily the problem, or even nausea. The problem is the uncertainty, the not knowing where to put my energy at any moment. And there's a lot of uncertainties, but they all break down, at least in my mind as an OT, to these: can I make the problem go away, or can I work around it? Like, it's unclear the extent to which, if I have 100 units of energy I could place in my life on any given day, should I spend 20% of those units on making the problem go away and 80% on working around it? Or should I flip that? It's really, really hard. And it's just it's just the reality. Like through time, like I want to give people hope that through time you'll learn, right? Like I've learned that, the timing of taking methotrexate. So I feel the fatigue 12 hours later. So I take it in the morning. Like there are things that you learn, and that's kind of the making the problem go away. But other times you can do that same thing and then get hit with fatigue. So, the reason I like mindfulness is that mindfulness kind of works on both areas, right? It's a workaround because you're not necessarily making the fatigue and pain go all the way away, but it also over time reduces it by bringing your energy to the present. So don't have too much time for this door analogy, but I'll just say that, my default personality, as you can probably tell, I'm kind of like a bubbly person. I've always wanted to kind of think positive and stuff like that. And, that is also a trap to some degree. Again, there's a degree to which reframing your thoughts can be helpful, but accepting the uncertainty, being able to sit with, and this is what my therapist has helped me with. I want to give a plug. I didn't just figure this out from reading Dr. Harris's book. I have a psychologist who is my therapist. She's amazing. And, she's literally like, can you just sit with that? Like the uncertainty. And I was like, why would I do that? It's a problem I have to solve. But she helped me accept that it's like an unsolvable problem. So I'm always going to want to go to the positive thinking door. And there's some people whose kind of neuro wiring are such that they're going to kind of want to go to the doom and gloom door. Like nothing will ever get better. Nothing I do will ever work. But the uncertainty is really what the reality is. So again, for me, just a little phrase that I use a lot is, can I thrive despite my symptoms, instead of saying I need to control them at all costs. So I created this room to thrive, like kind of framework. And this is my little color coding here, but it's the tools for pain and fatigue. This is all through self-management. It's skills for just the job of being a chronic illness patient, which those of you who live with it know that it's like a full-time job. So, we learn tools for pain and fatigue, learn those healthy habits, how to manage relationships and our mental health, how to engage in our valued activities, and the executive functions, as Dr. Lee Bagley said, it's super, super important to address those because it is a job of managing the disease. So that's it. So I'm happy to stop sharing my screen and engage with the Q&A section.